Welcome to this week's edition of Health Check, where my colleague Dr. Nosipho and I give you your weekly reminder to check in on your health. Join us in conversation on all our social media platforms at HealthCheckSA, where we engage on health matters at the comfort of your home. Now, every day, thousands of prescriptions are written out by medical practitioners across the country to treat a variety of conditions. But what happens when the very medication meant to help you get better becomes the cause of all your troubles? Prescribed medication addiction is often forgotten about in our conversations, but it's a harsh reality for many in the country. Dr. Nosipho is going to do a home visit with someone who's been battling with this problem.
Today, we're in Randburg, Johannesburg, where we're about to meet Michiel Bouwer, a lawyer whose ADHD diagnosis was the beginning of an incredibly difficult journey.
I got to a stage where I needed even more. Even that wasn't enough. And starting to suffer, I started struggling to get up in the morning, struggling to get to work on time. So things were really spiraling out of control. You know, the doctor was kind of becoming like, I don't, think you need more. This is like the highest that you could possibly go. So, that's when I started taking matters into my own hands. Because I believed very much that I needed to take more. So my name is Michiel. I'm an attorney by trade. And I've got a wife and 2 small kids.
Thank you so much for having us in your home. So to start our story, can you run us through your journey with substances? When did that start and what was the reason that it started?
So I've always been a crammer. I would always study last minute. I would always wait until the day before to study for an exam. And when I came to my final year of varsity, it started getting more and more difficult to do this. And whilst I was introduced to my first drug of choice in a social context, it very quickly turned into me using it as a tool to stay awake and to be able to study and to go through the night and study for the exams and then kept on working. So I never, had any diagnosis of any sort or was given any medication to assist with the way in which I was approaching academics specifically. So in a way I started self-medicating. And so I started using CAT specifically, which is a stimulant, and that just aided me in order to be able to really work those long hours and study those long hours.
And I understand in 2014, you then eventually went to seek medical attention in general. What happened when you went to the doctor?
So in 2009, I went into an outpatient program, and I kind of got off that particular substance. I got off CAT, and I had about 5 years clean at the time in 2014, but I still struggled. I still struggled working. I struggled to focus. There was this constant struggle, and now I'm in the thick of things as a young working adult, and really I still had the same struggles that I had been struggling with all my life. But because I did well at school and because I did well at varsity, nobody really thought anything of it. It was just that this is a particular way in which I was doing things. So I went to see a psychiatrist, and I told this particular psychiatrist my story of addiction. His response at the time was that the way in which I used CAT wasn't traditional, in that it wasn't recreational per se. It was in order to work and to study. And he asked me if I had ever been assessed for ADHD. I hadn't been. He did the test at the time, and I think I scored something like 19 out of 20. So it was quite evident that that was what was going on.
So that was when you got your ADHD diagnosis?
Indeed, yes.
And how did that make you feel, kind of having an answer to why you've struggled so long with the focus and concentration?
So it was kind of like a relief and like a moment of enlightenment, that all of a sudden it all makes sense. That it wasn't that I just, was lazy, because that's typically a label that comes with doing things in this particular manner. And obviously it's also, I didn't know too much about it. I thought that this was just the way in which I did things. I had poor discipline, I had poor time management, I didn't know that it was linked to a particular condition or a particular diagnosis. So it all started to make sense. And, you know, once I started reading about it and looking into it, there was so much that I could relate to and so much that looked familiar to me. And, you know, all of a sudden things made sense.
And what medication did they start you on at this point?
So at that point, I got prescribed Ritalin and Concerta.
Together?
Together, yes. I think initially it was just the Concerta, but very quickly, you know, I went back and said, look, I'm not quite there yet, because I kind of kept referring back to my history with stimulant abuse and the fact that perhaps I had built up a tolerance towards it, so that I needed a higher dosage than your typical individual would.
And when was the point where you started realizing that, like with the cats, you eventually sought help because you realized it wasn't very functional in your life? So with the doses of the medication you were taking, when did you decide there's something wrong, I need help?
I think my wife said that, you know, she could see things were not okay. So she told me, you need to go, you know, back to your counselor, your addiction counsellor that I had seen initially. And at first I went to that particular counsellor alone. I said, no, it's fine. I'm weaning off. I'm trying to manage it. I'm trying to use less. And I thought I had it all under control. Things kept on getting progressively worse. My wife insisted that we go back, and this time she insisted to go with me. And at that particular point in time, I was confronted to say that either you need to get back into a program, you need to seek treatment, you know, you've got a clear substance use disorder.
Michiel has taken responsibility for his actions and how they've impacted his loved ones. But it's clear that more needs to be done in the medical space to warn patients about the dangers of prescription medication. Dr. Sello, we need to understand, how can this be done?
Coming up next, we hear from our expert psychiatrist and a further check-in with our prescription meds addiction sufferer. Welcome back, and thank you so much for staying with us. According to the country's Central Drug Authority, at least 15% of South Africa's population has a drug addiction problem. Now, when it comes to prescription medication, a 2016 study showed nearly 15% of high school students are using prescription medication illegally. The South African Depression and Anxiety Group has said that abuse of opioids is responsible for 75% of overdose-related deaths. Now, this death statistic is larger than any other illicit or licit drug abuse. Join us on our social media platform, HealthCheck SA, and engage with us on TikTok, Facebook, and Instagram if you have any questions or comments. I'm now joined by psychiatrist Dr. Shakir Salduka, who's director of the Devon Pain Clinic and has extensive experience in the management of chronic pain syndromes. Dr. Salduka, welcome to our show, and thank you so much for giving us your time.
Thank you so much, and thank you for having me on.
All right, so let's start from the beginning. I mean, we talk about chronic meds addiction. Perhaps you can explain for our viewers, you know, the concept of addiction, and then we can talk about, you know, what sort of drugs people get addicted to.
Addiction, in essence, is a combination of two things. One is tolerance, where you need more and more of the addictive substance or activity to get the same high. And the other one is dependence, where you get withdrawal symptoms trying to stop. So anything where tolerance and dependence are factors, they can be regarded as addiction. That doesn't just apply to chemicals and drugs, illicit drugs and prescription drugs, but also to activities like gambling, sex addiction, and so on.
All right. So coming back now to, you know, prescription medication addiction now. I mean, obviously this is a serious problem. Can you perhaps just share with us the extent of this problem, to the extent that we know it?
That is the problem, because prescription medication is perceived and seen to be safe. It's written by doctors and available at pharmacy. It is very difficult to actually get accurate statistics of prescription medication overuse in the country. By and large, the definition of overuse is also widely disputed. I mean, if somebody takes a painkiller once a week, is that overuse? If someone takes a painkiller every day, is that overuse? So for various reasons, it's difficult to get accurate statistics, but the estimated statistics based on other countries' data is anything from 20 to 30% of the population abuse or use prescription drugs that they should.
So people take medication for a variety of reasons. You know, for instance, let's take an example of someone who's had an injury and takes medication for pain. At what point then, you know, do we move from taking medication for the reason of pain to that of addiction?
So that is the million-dollar question. And I think there are many reasons that determine transition from overuse to abuse. Interestingly, they tried to answer this question in a study that they published out of Stanford University some years ago, where they looked at the various reasons people end up the syndrome called chronic pain syndrome, where they live with pain, basically. And in America, it's a huge problem, it's a massive problem, which is why they have this opiate epidemic currently as well. And they studied just about, as many things as they can study about people to find what is the common factor that determines who's going to switch from using painkillers judiciously to people that are going to be using it excessively. And again, as I said earlier, there are certain genetic predispositions, there are personality types, but interestingly, and this was the one that surprised the researchers, is they found that 83% of the people that suffered from chronic pain and were using analgesics had a history of childhood trauma, had a history of early childhood sensory deprivation syndrome trauma. And then it makes a lot more sense if you understand that these are people who live with emotional pain, which these drugs can alleviate because they have that sense of euphoria and being. And then they get confused between the physical pain and the emotional pain. And the other thing to remember is certain cultures, and this is very important in South Africa because we've got so many different cultures that live together, don't actually have terminology and language to describe depression, and sadness, anxiety, and so on. And they are often expressed as physical symptoms. So you'll often get, a person presenting with chronic headaches where you can find nothing, but they're actually depressed. So that's why they end up using painkillers, probably. Long-term effects of any drug that works on the brain, for example, codeine, which is morphine, which is heroin, benzodiazepines, over a prolonged period of time, interferes with the normal circuit function. So when we talk about the advanced brain, we talk about three main areas of brain function. Cognition, which is your thinking, your concentration, your focus, your intellect. Emotion, which is your feelings, sad, angry, happy. And behavior, which is the product of cognitive and emotional function. So when you look at these drugs, those are the three things that get affected. You get a decline in cognitive function, so people end up over long periods of time with subtle changes in their ability to concentrate, their memory, their intellectual capacity, overall their functionality. It all depends on time and quantity. Then you get emotional dysregulation, because if you think about how these drugs work, when you take them for a few hours, you feel pretty good. And then it wears off and you want to feel that good feeling again. So then you feel grumpy and irritable until you take it again, then you feel good again.
And then you've mentioned that you then started your program with rehab, right? And this was 3 months in when you actually started realizing how bad things were when they were at their worst. How was this program? Was it an inpatient program or were you at home? How did they structure that?
So I was in an outpatient program. I attended, it was 5 days a week, so I continued working. I certainly didn't believe that I would be able to take time off work. So at 5 p.m. I went to the program, and then I did 2 hours there, 5 days a week. And on top of that, it's mandatory to then attend a 12-step program meeting, either NA or AA or something like. So I attended the outpatient program, but I still do actively attend Narcotics Anonymous meetings.
And with the filling of these scripts, you mentioned you were going to different pharmacies and all of that. How difficult or easy did you find doing this was?
I think there is some controls in place, but they're not insurmountable. It's something that I needed to keep track of. I needed to see, like I said, multiple doctors. I needed to get multiple scripts. You need original scripts. So there are some challenges, but I was able to figure out ways around them. So different doctors, different pharmacies, keeping track of them. So, looking back at it now, it was effort, but it was possible. There's no, inter-reporting between different pharmacies. So going to different brand pharmacies, making sure that I just know to which one I went, at what stage, and that I would leave a month in between. But, being in Joburg, there are plenty of pharmacies around.
And do you feel like, having had experience with the street drugs, like you mentioned, that were not legal to obtain, and prescription medication, do you feel like you were warned fairly of the dangers of how it could go with this medication when you sought medical attention?
So, bearing in mind that, at the time, I had seen a psychiatrist, a specialist in the field of medication. I had fully disclosed my history with addiction, and I was still prescribed this substance. And I think that there's probably a lack of education of the risk, of the abuse potential of the drug in isolation, but so much more for somebody with a history of addiction. So no, and even at the dosages that I was prescribed, admittedly, I pushed for a higher dosage. Admittedly, I ended up doubling and tripling up on the scripts. But I think being given access to that particular medication to start with was probably not a good idea. And like I said, I think that it's a fair diagnosis that I was struggling with ADHD. But the risk that came with taking the medication, for that to be the first line treatment in my particular case, I don't think was necessarily the best idea. So I think that there's generally a lack of appreciation and understanding around addiction, and even more so around prescription medication. Because it's viewed in a favorable light, generally it's viewed as being safe. And that's not always the case.
It's clear to see that Michiel's journey has been very trying, and it's still an ongoing one. But how does someone like him, who has a chronic condition, now balance managing that condition without falling back into addiction?
So we spoke earlier about, some of the long-term effects. We know that there's a statistic that we, came across about opioids being responsible for 75% of overdose-related deaths. Why opiates? Why such a high death rate?
So as I said earlier, opiates all belong to the same group of drugs as heroin. So they all started with opium, which is from the poppy seed hundreds of years ago. And the opium trade is still quite a big drug trade in places like Afghanistan and so on. So opium is still available, and from opium we got heroin, from heroin we got morphine, and then we got pethidine and so on. So all that, from opium all the way down to the benign Stilpain, Adcodol, Sindol kind of tablet, is the same thing, just dressed up prettily. And what these drugs have a tendency of doing, besides alleviating pain, they give you a sense of well-being in small doses. But in high doses, and a lot of people don't realize this, they are potent respiratory suppressants. In other words, they stop your breathing drive in the brain. So that's the commonest reason people die from opiates, is because the overdose switches off the respiratory drive in the brain. They are respiratory suppressants.
How do you treat, or how are people that are addicted treated, and what's the success rate?
There are lots of similarities between the effects of prescription drugs and illicit drugs. So for example, if we look at the most common abused drug is analgesics, then we have to detox the person. Because if they're taking a large amount on a daily basis and they go cold turkey, they can get into severe withdrawal states. And withdrawal can range from just physical discomfort, nausea, vomiting, diarrhea, shivering, body aches and pains, to respiratory arrest, cardiac arrest, seizures, psychosis can all happen during a withdrawal state. So it is not advisable if you're taking a large amount to try and stop cold turkey. It's better to do it under supervision, and we do what is called detoxification process, which with opiates, strangely enough, works very well and usually is successful within a week to 10 days maximum.
So, Dr. Shakir, your final thoughts then on prescription meds addiction?
I think it's important, apart from the medical profession, to get more knowledgeable on this, on the general public, to become more curators of their own health, and to ask questions. Always ask your doctor, how long can I take this for? Is there a problem if I take it for more than a week or 2 weeks? The biggest thing I see in practice is patients just don't ask, they just blindly accept what doctors tell them. It's critical to ask questions, know your risks. Google, you're living in the age of, information is available at your fingertips. You can Google anything. What we lack is wisdom. So we need more wisdom. Information is freely available.
I think it's on that wise note that we'll come to the end of our show. Thank you so much, Dr. Shakir. And yes, all the best in your work. So what's clear from today's episode is that prescription drug addiction is something the country needs to keep a close eye on and not let people suffer in silence. Now, should you think you know someone who might be dealing with prescription drug addiction, please reach out to us on our social media platforms and tell us your story. We're at Health Check SA on all social media pages. Well, we hope that this episode of Health Check has helped you check in on your health. And until then, stay healthy, stay vibrant, and check in on your health.